Children's Types by D.M Borland. Enlarged Glands in Children. BROMIUM. The next common warm-blooded drug is BROMIUM. It is one of the drugs which is very frequently missed. The common BROMIUM type of patient is usually overfat, fair-skinned, fair-haired, and the majority are friendly, cheerful, fairy happy types. There are contradictions. The fairly cheerful, happy, friendly type are very easily put out, and if upset, they very commonly flushed up, and explain that they get a feeling of heat and tension in their heads. They become nervous, anxious, very often frightened in the evening, and very much about the Pulsatilla time. They do not like to walk home in the dark and have the impression that somebody is following them. And they get scared very much like the symptoms of Pulsatilla. They look not unlike Pulsatilla, and occasionally bouts of depression in the BROMIUM patient are not unlike Pulsatilla. But BROMIUM is a much more placid depression, much more a melancholy outlook than the acute tearfulness of the Pulsatilla. The BROMIUM patient is a rather fat, fair type tending to run to crops of boils, either acne about the face or over the shoulder, and an adolescent needing BROMIUM always has some acne spots about. There are further symptoms very like Pulsatilla. They are very sensitive to heat, uncomfortable in the sun, and definitely uncomfortable in a hot room. They are better for motion and for exercise, and better in the open air. By contrast, the typical BROMIUM patient is very much better after food, whereas typical Pulsatilla patient is heavy after a meal. And another contrast, in spite of the fact that they are better in the open air, they are sensitive to drops. The majority of the BROMIUM cases are of two types, one of the chronic catarrh of upper passages, the other the typical acute hay fever. Taking the catarrh type first, the child with chronic hypertrophy of the tonsils, not the type who is liable to recurring quinsys, but one with an enlarged fibrotic tonsils, and often with the general enlargement of the submaxillary glands, which tend to be hard and tend not to break down. With the chronic tonsils, they are liable to acute attacks of catarrhal extension to any of the sinuses, but in BROMIUM cases it is more commonly the frontal sinuses that are involved rather than the antrums. With the involvement of the frontal sinuses, the patient complains of intense pain, fullness, and a feeling of swelling at the root of the nose. The nose feels choked up, and there is a thick yellow purulent discharge, and if any violent effort is made to clear the nose, the discharge is liable to be blood-stained. Another point about the type is a thickened, rather inflamed, reddened upper lip. Occasionally, one of these children will get an attack of very intense croup, with the sensation of tickling in the larynx. The very violent croupy cough goes on almost to suffocation and is relieved by cold drinks. They may complain of a feeling of pressure or constriction of the throat, and the larynx in these cases is usually very sensitive to touch. There may also be the typical BROMIUM hoarse voice. BROMIUM is useful for the fat, warm-blooded child with rather hypertrophied tonsils who gets an attack of hay fever coming on usually about June, rather later in the BROMIUM child than in many of the others. Some starts in the middle of May, but the BROMIUM cases do not usually start with until June. The outstanding characteristic of the BROMIUM hay fever is an extreme hyperesthesia of the mucous membranes, and dust of any kind will set up an acute attack during the irritant period. One small boy had a typical BROMIUM hay fever, and if he went into the room which was being dusted, would start a violent attack right away, quite apart from any exposure to irritant out of doors. A few doses of BROMIUM completely stopped it. These bromium hay fever cases may get asthmatic attacks, which are fairly typical. They get very sudden spasmodic attacks with a sensation of extreme constriction of the chest and extreme difficulty in swallowing. Another point is that although their apparent hay fever does not entirely subside at the seaside, their asthma entirely goes. Another type in which bromium is very useful is similar. The child is fat, tonsillar, sensitive to heat, with a definitely sluggish tendency, and in addition, there are generalized rheumatic pains, a type of muscular rheumatism. They are also very liable to cardiac affections, more likely a poorly acting cardiac muscle than a definite valvular lesion. But in some cases, there is definite cardiac hypertrophy in that of child, and they have improved very much indeed on bromium. The constant in all these cases is the feeling of constriction in the chest, feeling of tightness or constriction over the heart. Another constant is that feeling of constriction has developed when they have been facing any wind. There is also the sensitiveness of drops, which is particularly noticeable in bromium heart cases. IODUM. The majority of IODUM children are dark-haired and rather dark-skinned and intensely restless. They are very thin children, never still, always on the move, wandering about, fidgeting, restless. This is an outstanding feature of these cases. On questioning, you will be told that these children are definitely irritable, and their irritability is characteristic. They are perfectly happy playing with other children, and then suddenly, apparently for no reason, they break out into violence. Very often they are playing perfectly happily with a brother or sister, and suddenly they pick up something and hit them. It is that sudden impulsive irritability that is the typical IODUM mental characteristic. Very often after such an attack of irritability, the child is extremely depressed, not weepy but just silent, depressed, rather losing interest in things. These children usually have very large appetites. They are hungry for their meals and they are hungry between meals. They become utterly exhausted if they go too long without a meal and are very liable to get headache for hunger. Although these children eat well, they can never be fattened. They remain thin and may actually be losing weight. IODUM children are very sensitive to heat of any kind. Hot rooms, hot sun, hot fire, hot baths, heat in any form aggravates typical IODUM child. These IODUM children often have a rather inactive skin. They get attacks of acute infection of the nose with a tendency to spread into the frontal sinuses. And with such an attack, there is an irritant, watery discharge and a feeling of obstruction at the root of the nose, and it is tender on pressure. Frequent with the coryza, there is a very hot discharge, a tendency to sneeze, and with the discharge always very watery eyes. There may be a history of repeated attacks of that sort, followed by development of typical asthmatic breathing. With these thin children with a good appetite, with a short of history, and with asthma, which is definitely better in the open air, IODUM will usually meet the case. These IODUM children with that kind of extending catarrhal infection very often get a degree of deafness, which is usually associated with the chronic eustachian catarrh. Another feature of IODUM children of that with catarrhal infections is in involvement of larynx. They are very often hoarse and have a painful larynx, which is tender on pressure. With the laryngitis, they are apt to get acute croup attacks, which are extremely painful. One of the distinguishing points about these croup attacks is that the child gets very hot and has a intensely hot, dry skin. Very often in these croup attacks, the child is terrified. They could be mistaken for croup of arsenicum type. There is the same feeling of heat, the same burning in the larynx, the same kind of restlessness and anxiety. The child is very often terrified and there is the same kind of choking feeling. But the arsenicum child is chilly, whereas the iodum child is hot and wants air. The arsenicum child will perspire slightly. The iodum child will be dry and hot. The iodum children are very liable to get all sorts of abdominal disturbances, almost of which are associated with very typical diarrheic attacks, with very frothy, fatty, whitish stool, and may be associated with enlarged mesenteric glands. They may be associated with general enlargement of the liver and spleen without any very definite blood change, or with definite pancreatic dysfunction with the typical pancreatic fatty stool, and there may be glycosuria. The iodum children with a fair amount of color, quite bright red cheeks, are very liable to get rheumatic symptoms. It is usually an acute rheumatism with violent pains which are eased by moving and are very much worse from heat. The pains are usually very sharp and stabbing in character, and there may be a pericarditis with acute sharp pericardial pain. One thing about the pericardial cases is apparently a contradiction to the ordinary iodum restlessness and relief from motion. The chest pains are aggravated by moving. The pains are brought on and are made more acute by movement. It is very easy to confuse the rather dark-skinned, flushed type of patient, rather depressed with sharp stabbing pains which are worse from motion, with the bryonia case. They are both worse from heat, but there is not the typical bryonia tongue in the iodum patient, not the intense thirst as a rule. Most bryonia cases are more dull and heavy, while the iodum patients are more mentally alert. There is usually a complete aversion to food in the bryonia cases, and very often a surprising amount of hunger even in the acute iodum condition. There is certain similarity between iodum child and the BROMIUM child, but it is an entirely different type. The various symptoms are very much alike, but once the type of child is recognized, it is not possible to confuse them. Iodum can easily be confused with sulphur, but there is not the intense irritability of skin, the intense itching in a similar type of sulphur. One other feature of iodum quite frequently met with in rheumatic cases is a history of an acute diarrheic attack immediately preceding the rheumatic attack.